I think the focus really today is on the modeling, and as I go through, I will be giving an update of our situation here in Prince Edward Island. I'd like to start by saying and echoing the Premier's comments that we are in this together, and what we'll see in the next few slides just reinforces that we've been in it together and we will continue to be in it together. The modeling has been put together with a really great expert group of modelers from the Atlantic Vet College, epidemiologists from the Health Information Unit at Health PI, outside of government as well, or outside our office in other parts of government as well as within our office. Really, we're very fortunate to have this very expert group of modelers. So models are just one of many tools to inform a public health response. It can guide responses, but it is very sensitive, certainly, to the numbers that we see as we go forward. Today is really an assessment of our current status of COVID-19 epidemic in Prince Edward Island, and to look at some of what these models and the outcomes could be with different public health intervention scenarios. We recognize that models are imperfect, and as I mentioned, it's just one of many tools. We know around the world there have been more than 1.9 million confirmed cases of COVID-19 and over 120,000 deaths. And across Canada, there have been more than 25,000 cases of COVID-19 and more than 780 deaths. While there are no new positive cases to announce for today, I would like to mention again that 23 of the 25 cases are considered recovered, and we have close to 2,000 tests done here in Prince Edward Island. Those testing numbers are putting us at PEI in terms of our population testing numbers just above the Canadian average. Across the country, hospitalizations are about 19% of the cases that occur in the country, and of those hospitalized, 28% are in the ICU. And our modeling numbers do also take into account these hospitalizations that occur in the rest of the country. PEI has fared better than many other provinces and territories, and that's many thanks to people who are listening and those who aren't, in terms of your behaviors and your adherence to the public health measures. And although it may be difficult for some to see, we are on a green line, which means our cumulative diagnosed cases per 100,000 population certainly is lower than many other provinces and territories. The next slide really just is an outline of our key public health measures timeline in terms of when certain measures were introduced. For instance, on March 13th, international travelers were told to self-isolate for 14 days and we advised canceling non-essential travel. On March the 21st, public health orders were issued for screening at points of entry and for self-isolation after out-of-province travel. And as we look forward, in terms of PEI's approach to modeling, they are not crystal balls to predict what will happen, but they can help us understand what might happen. And they can give us a picture of what could happen, and this will help us plan, and it's a way also to communicate. We are using what we call a compartmental model to project how the epidemic may unfold, and it uses data from other countries, Canada, and PEI to model the spread of COVID-19 in PEI. And it creates scenarios using a range of data values. And scenarios are created to better understand what may be required to control the epidemic, reducing the number of people a person infects to less than 1. So we have borrowed one of the slides that was made public from the Public Health Agency of Canada, because I think it shows a description of visually of what we're trying to achieve. So if each person infects fewer than one person on average, the epidemic will die out, and that's what our goal is. Our estimated Canadian R naught, and so that's how many people someone would infect. So prior to stronger public health measures in Canada, it would be 2.2, and our goal for Canadian R naught for the epidemic to die out would be less than 1, and we would have that same goal here in Prince Edward Island. So we have focused on 2 scenarios, one with mild controlled measures and one with strong control measures. So mild controlled measures would be, we might identify a high proportion of cases, which would be isolated, but we'd have a low degree of physical distancing, a low proportion of contacts who would be traced and quarantined, and a low proportion of self-isolation by out-of-province travelers. And then the other scenario is where we have strong control measures, and that would mean we have a high degree of social or physical distancing, a high proportion of cases identified and isolated, a high proportion of contacts traced and quarantined, and a high proportion of self-isolation by out-of-province travelers. And that is what we are having right now, a very strong control measures in Prince Edward Island. And if there is good adherence, one more person is infected for each case, as opposed to in mild control measures where 2 people would be infected. The outcomes that are presented today are for the first 80 days of the epidemic in PEI, from our first case identified on March the 14th. And the projected total patients admitted into hospital for the mild control scenario is more than 100 times larger than that for the strong control scenario. And the highest projected acute care bed needs per day for the mild control scenario is more than 200 times larger than that for the strong control scenario. And because our COVID-19 status over the last month has remained stable, and there have been really the travel-related cases, no hospitalizations, and no fatalities, if we decided today to release the public health control measures to be like a mild control scenario, the projected curve would look the same as what you see on the screen as the blue curve for the next 80 days. The dotted line across the bottom represents the current available acute care beds in our province, which is at 207. So as soon as we get above that dotted line, that is when we exceed our capacity. But we right now are having such good, strong control measures that we are well below that dotted line. As soon as we go above, that's when we exceed the capacity in this province. And that's with mild control measures very quickly accelerating. Our critical care bed needs for COVID-19 by June the 1st, again, starting on March the 14th when we had our first case. And the highest bed needs for the mild control scenario is more than 200 times larger than that for the strong control scenario. If only mild control had been put in place when we had our first case, so we hadn't implemented these public health measures, it's possible that the critical care beds that we have in this province would be full by today. But because our status has remained, over the last month, has remained very stable, as again, the travel-related cases, no hospitalizations or fatalities, we're in a good position. But if we were to let go, again, of all our public health measures, it would look, the curve would continue for the next 80 days. And really if we let go today of all our measures, by mid-May, we would exceed our capacity for critical care beds here in Prince Edward Island. The projected total fatalities from COVID-19 for the mild control scenario is 100 times larger than that for the strong control scenario. And in many ways, the numbers are less important than knowing the degree of what it shows us if we do not have public health measures in place, and what would have happened if we didn't start them when we did. Another slide which shows again the cumulative fatalities from COVID-19 by June the 1st. For the mild control scenario, again, much larger than for the strong control scenario. And again, if we decided today to release the public health control measures to be like the mild control scenario, the projected curve would look like the same blue curve from here for the next 80 days. Our actions have made a difference as islanders. And I think if there was one message I would like people to realize, it would be that. We are still in an early phase of the epidemic, and as such, we do have an opportunity to control the remaining part of this epidemic. We know what public health measures are required: physical distancing, we have talked about it at length, self-isolation about its importance, testing to find cases, rapid tracing of contacts. The next phases in this model, the next steps, would be to assess scenarios for modifying these public health measures and or testing strategies to control the epidemic without overwhelming our health capacity. When I asked others what they thought of this model initially, I heard different responses. One, this is motivating and reassuring. Motivating that we have been doing the right measures, and motivating that we need to continue to do so. It's also reassuring that our actions have made a difference. These are powerful models in many ways because it shows us what could have happened, what will happen if we don't do some degree of public health measures going forward, and it puts it in perspective. What we will do in the weeks ahead will also make a difference. I certainly don't want us to risk what we've accomplished to date by going too quickly to ease up. But I know, as the Premier mentioned, we all are looking forward to that process. If we do nothing, it will be a lot worse. But it will be better for us if, as a community, as a province, if we continue to work on these public health measures and help our health system and make sure it has a chance to manage in terms of its beds and its ICU capacity. Modeling is a challenge, certainly, in a province of our size, and we do this with a delicate balance going forward. But I will say we will continue to come back every couple of weeks to update these models, reflecting what our current status is and what we can learn as we do more dynamic modeling in different scenarios.
Question is for Dr. Morrison. From the slides, I don't see a prediction for the total number of cases. So I know you went into hospitalizations, the number of deaths, but what do you suppose the total number of just infected will be on PEI with strong measures?
So good question, and I think some of the models across the country have looked at infections versus actual cases, which is different in different places. We focused not on our actual cases who would end up in hospital. I don't have the numbers in front of me about the presumed cases, but it's certainly we know that about in the country, as I mentioned earlier, 19% of the cases in the country are being hospitalized. But that's exactly the kind of information that, without any hospitalizations, it's going to be difficult in some ways for Prince Edward Island. So every couple of weeks when we come back, that will be reflected and updated, and we can certainly include that on the next, our actual cases, and not just in hospital beds on the next round. That would be a good thing to include.
Thank you. And my next question is about, on the slides, it shows that even with controlled measures, you're predicting that there could be at least 9 deaths and 120 people in hospital. What do you make of those figures, and how does it inform or change the way you're preparing the public health response?
Well, I mean, if I had a choice, I'd hope that there would be no one in hospital and no deaths. And I still can hope for that. When I look at those numbers, it is really, are we going to be able to manage as a system in terms of our critical care beds and our acute care beds? And are we going to be able to manage the volume and the number of people who could get sick in this province? So, and I think in terms of the 120, if that is spread out over a period of time, our system would still be able to manage that. What we cannot manage are hundreds of cases a day who require a hospital bed. And it's so it's to manage that. And so right now, if based on what we have been doing, our system has been managing and would continue to manage, but it's how quickly it could change as well if we had a long-term care outbreak. And that's why in many places modeling is so challenging, because one outbreak with a number of hospitalizations and deaths would be dramatic in any province as well as here.